Okay. Hi, everybody. Hi, Cynthia and Karen. Thanks for typing your words of love in the sidebar. Yes, I had that experience a couple of days ago when I was putting together the C-hip updater. I'm just trying to adjust my screen here. I think it's too bright, isn't it? Hold on. Oh, no, I didn't want to do that. I'm just playing around with the technology. And I had one of those moments, one of my ADHD moments, where I hit send before I reread the email one more time. So I think the email made it sound like I might have had a far worse summer than I actually did. I might have just been I might have been taking too much poetic license in pouring out my soul in that last C-hip updater. Hi, Anita, welcome. And I want to let you know that, so I sent that C-hip updater to let you all know about our first clinical huddle of the academic year. And I had in my mind that you already knew about this date, because usually when I send out the recording, which I will do after this session, I'll send out the recording, I always include the date for the next session. And it looks like I didn't do that. So some people did not have enough notice to join on this evening's clinical huddle. So I apologize for that. I apologize for the short notice. I have been all over the map without Nita, the admin support for Daybreak. And Nita, thank goodness, the goddess of administrative support, she will be back October 1st. So hopefully you will have minimal events in terms of not getting enough notification. Hopefully I will be more on the ball because Nita will be by my side. Okay, so I know a lot of you are really interested in the specialty topic that we chose for tonight, integrating clinical hypnosis with EMDR. And I've invited Heidi K-Sweeter to join us. Heidi is a EMDR clinician as well as a clinical counseling hypnotherapist. And I'm going to be asking Heidi questions about how she integrates hypnosis with EMDR. And then I'm going to open it up to you guys to, oh, I better make sure this is all working. I think it is. I'm going to open it up to you guys to ask Heidi questions about the interplay between EMDR and clinical counseling hypnotherapy. And we'll also have time to take like any clinical Q&A questions that you have and that you want to bring to the group. Those are also welcome. You guys know the drill. I think most of you have been on these calls before. If you hear a doorbell or a dog barking or a young adult saying, "Mom, I'm home," you understand we're live. So that's how we roll here. So let's hope we don't get too badly interrupted tonight. And looks like you guys can all hear me okay. So I am going to just check if, oh, Heidi's here, good. Okay, so for those of you who don't know, you can type a question in on the sidebar. I'll be watching them. If you have a question for Heidi or for myself, you can also click on the Ask a Question section just below your screen here. You see call to action, ask a question, etc. We won't be taking any polls tonight. So you could just click, oh, Anita, it's your first clinical huddle. So here I am. I better spell this out. So you can click on Ask a Question. And when I get a little pop-up saying someone has asked a question, then I'll answer it. So that's one way you could ask a question. Another way you can ask a question is just type it in the sidebar like you did now. Anita's saying it's her first huddle. Welcome. And there are a few Anitas out there. There's one in Ottawa. There's one in Toronto. Which Anita are you? Assuming the audio-visual is only one way. Hey, Dawn. Nice to see you. Haven't seen you in a while. Anita from Ottawa. Okay, welcome, Anita from Ottawa. Okay, welcome everyone who's here. Looks like we're all in and we're all hearing and seeing everything. Okay, so let's jump right into the topic at hand. I know a lot of you are either trained in EMDR or you are getting training or certification EMDR, or you're just curious about it. If you've never heard of it before and you're just interested in those initials, for those of you who might be watching the recording, I think this would be more you. So EMDR is eye movement desensitization and reprocessing. And it is seen as an integrative psychotherapy approach that was developed by a psychologist named Dr. Francine Shapiro. And she developed EMDR in the late 80s. There's a famous story about how she started to think about what would become EMDR, in that she was walking through the park one day and was having distressing, overwhelming thoughts. And she noticed that when she moved her eyes a certain way, that the emotional intensity of the thoughts would dissipate. And so she got really curious about that. And as most of you know, because I see a lot of you who are using EMDR on the call tonight, or you're starting to use it, or you're about to go for training on it, she has dedicated so many decades now to ensuring that this standardized set of protocols known as EMDR, or originally it was, the research was done mostly in the area of trauma, and it's still well known for efficacy with trauma. But she's dedicated so many decades to ensuring that there's been high quality research done on these protocols. And so most of the research to date, to my knowledge, and Heidi, I'm going to invite you on soon, so you're going to elaborate for me. Most of the research has been done in the area of trauma and PTSD. Great research, great outcomes. And we're starting to see more research in other areas. I know it's been helpful for panic patients, anxiety clients. And so I think we're going to see more in terms of the research with outcomes for EMDR in other areas besides PTSD, trauma, anxiety, and so forth. So really exciting stuff. In the clinical counseling hypnotherapy certification, we do teach clinical hypnosis as an integrative application. We talk a lot about integrating it with CBT and solution focused, but there hasn't been a lot of airtime for integrating it with other modalities like EMDR. And a number of you are really interested in this area. So let's get that conversation started. Like, how do you work with those two interventions? How can you be hypnotic? How can you use your skills as a clinical counseling hypnotherapist, when you're working with EMDR and with the protocols? So I can't talk too much to that directly. Well, I can't talk at all directly to that because I am not trained in EMDR. But that's why I'm going to bring Heidi on now. So Heidi, stand by here. And let me just get this together here. I've got to bring her online, so I've got to click invite on screen. Okay, here we go. We just invited Heidi on screen. And Heidi is in BC. Hello, Heidi. Can you hear?
Hello, Karen. Hi, everyone else.
Hold
on.
Can
you hear me?
We can't hear you. Hold on. I'm going to turn off my...
Can you hear me now? I can't hear you, Karen.
I can hear you. Can you hear me?
I can hear you now.
Okay.
Okay.
How is it for everyone out there? Can you guys hear us? Yeah. Looks like they can. Yes. Oh, Annette's here. Hi, Annette. Okay, Anita's saying good. Okay, so far so good. Let me I'm gonna, hold on. I just decided to unplug my mic in case there's some feedback. But so far, so good. So everybody, Heidi is out in Prince George, right?
Prince George, British Columbia.
For some reason, I always want to say Prince Albert.
Wrong province.
That's wrong province, yeah. Okay, and so Heidi, thank you for coming on tonight. And I'll just start with the general and ask, because inquiry minds want to know, ask about us. Hi, Kathy. Oh, Kathy from Saskatoon is here. It's okay if you're late, Kathy. Don't worry. She's so polite. Inquiry minds want to know. So tell us in general about some successes you've had or successful applications that you've seen in terms of like using hypnosis and EMDR together.
Okay, so first I will say that I was originally trained in EMDR, and I very much enjoyed it right from the beginning. And the one place where I was hesitant in using it was, all those what if questions that you have for, the severe trauma. What if it goes sideways? What if it doesn't feel like it's working? Those types of things, like when you start any new sort of modality of treatment. So once I did my training in hypnosis, I actually found that my confidence with EMDR increased. So I felt like it gave me sort of other options or other modalities to integrate into EMDR in those cases where maybe it wasn't exactly what I thought the outcome was going to be for EMDR. So a specific example of that would be most recently I started seeing a client who has very severe PTSD. And we started all of the EMDR protocols. So we did the history intaking. We started to create the timeline. We had discussed her safe place. And then the first session where we started to actually get into the EMDR reprocessing, so the actual eye movements, she right away started panicking. She did the stop signal within about 20 seconds. She just had tears rolling down her face. Her eyes were closed the entire time. And she just wasn't able, or she wasn't ready to start doing the reprocessing. So what I decided to do in that case was to start using hypnotherapy to create a safe place for her. So even though we do that in EMDR, she wasn't able to access it on the level that I find people can access it through hypnotherapy. So she had told me that one of her favorite places is sort of in the woods, down by the creek. But after we'd started doing the reprocessing, she felt so hypervigilant, so panicky. She just couldn't even fathom getting herself to this safe place. So what we did is we paused the EMDR and we did 3 sessions of just using hypnotic interventions to really stabilize her first place or her safe place. So the first session was all I did was take her to her favorite place by the creek on a beautiful day. And I talked about all of the colors and, incorporating the breeze and the sun. And that was basically it, was just getting her to be able to feel and see her safe place in a different level. So I really found with her, she hadn't felt safe since the traumatic event had happened. So even in that first hypnotherapy session, she was in trance, but she was crying, she had tears, but it just wasn't as intense of a reaction as it was doing the EMDR. So our second session, I started to incorporate some metaphors. So I said, look at the water flowing by and how free it is and how leaves wash by. So I was trying to get her ready for that idea of letting memories flow by and letting, some of the things that I knew we were going to be doing in EMDR, starting to incorporate that in. Her third session of hypnosis, I actually started to bring those concepts in. So I'm like, just like the water flows by in the creek, so can your memories, right? So can your experiences, and just really started to stabilize and strengthen that safe place so that when we get back into EMDR, I feel like she can really feel it and connect to it versus just sort of the logic of, okay, let's go to your safe place. So I just found it really helped intensify that part for her.
And it sounds like it helped the hypnotic, like having her in trance around the safe place, helped really anchor it in so she could like
Absolutely.
Yeah.
Yeah, where she really wasn't like, she could talk about, the safe place when we started doing the EMDR, but she couldn't feel it. Right. Whereas I felt like by doing it through hypnosis, she could feel it. She could feel the sunshine on her face. She could hear the sound of the water. So it was much easier for her to access after sort of doing 3 sessions of the resource building of the safe place, before getting back into that intensity of the EMDR.
So that was really your clinical judgment on when to hit the pause on the EMDR and
Yeah.
to do some like ego strengthening, some anchoring, integrating that safe place before hitting the start again button.
Right.
So
So
to
we just took a pause, right?
speak.
Another example where I've taken sort of a therapeutic pause from EMDR is I was working with another client who had a lot of childhood abuse, from her family of origin. And we'd been working through it beautifully. Everything was running very, very smoothly. She was reprocessing the memories, as that ideal outcome that you hope to have. And I seen her sometime during the week, but on the Friday, she was supposed to go pick up her mother from the airport, who is a lot of the work that we had been doing with. So she was very, very apprehensive about going back to those places and looking at those memories. She was very fearful that it would bring up a bunch of anger, and that she didn't want, during that weekend visit, right? They were trying to rebuild their relationship. She was doing this work for a reason. So I said, no problem. So we just took a pause. And what we did that session is I did a hypnosis session on ego strengthening, on building her confidence, on a lot of the work that we had done in EMDR, but really sort of focusing it for her, that she could be strong, that she could use her boundaries, that she could let things sort of slide and sort of, have more freedom with it. So it was a nice break, from doing that really intense reprocessing. She just didn't really have it in her to go to that place knowing that she would be, sharing house with her for the next 4 days.
Well, that makes total sense. It makes me think of when I talk to people who do a lot of yoga, and so they'll do hot yoga and they'll do, I don't know, Kundalini, and they'll do some other thing that I can't even imagine, let alone try. And then they'll say, oh, well, today I'm just having my, what do they call it? They call it a rest day or something.
Yeah.
Well, there's a word for it where it means they're doing like light yoga, like just holding positions. Can't remember what the word is. Restore it. Thank you, Anita. So it seems to me like in this case example that you shared, this was kind of a restorative approach whereby you were able to bring in some hypnosis.
Right. And it really does actually start to strengthen the EMDR work that we've done. So she could actually start to visualize and see the changes that she had made and the memories that she had already started to reprocess, right? So it was giving her a more positive viewpoint to set her up for the weekend.
Oh, that sounds amazing. Wow. So do you ever have situations where maybe you're doing EMDR and you think, oh no, well, you've talked about pausing. Do you ever drop it completely and go hypnosis? Or do you ever start doing clinical hypnosis and say, no, we're just going to go straight EMDR?
Yes.
Okay.
So one example I have of that is I had a client who came in and she specifically wanted to do EMDR. She was adamant about doing EMDR. She has to do EMDR. So when we started doing the history taking and we started making the timeline, after about a session and a half, I had pages and pages and pages and pages of notes of sort of what they call the little T traumas. So again, a lot of childhood stuff, fairly sort of abusive sort of family, a bunch of other things that have come into play, and it just seemed to never end. And we had only gotten her to about age 8, and I had about 10 pages of history taking already. So I'm like, for EMDR, this is going to take us a long time to start reprocessing it. So I did say to her, I said, well, with all of these things, there seems to be a theme. So I said, for homework, I gave her, I said, if you could think of a theme of your childhood, what would be the 3 main categories that you feel have still stuck with you? Where do you really feel this is represented in your adult life? So she did her homework. She came back and she said 3 words stood out to me. And she said shame, guilt, and the word ugly. And I said, okay. So I said, we could do the EMDR approach. I said, or why don't we try a hypnotherapy session, working with letting go of those 3 words and replacing them with 3 new words. So I had her take those 3 words and tell me in her own words what she'd like to replace them with. So I did a hypnotherapy session with the induction, the deepening. I sort of had her, I took her to the beach. It's her favorite place to be, to write the old words in the sand, to have the waves wash them away. And as they washed it away, she could feel lightning. Went through all that, sort of stilled the new words that she wanted to have instead. Tears sort of started to form near the end of the hypnotherapy session. She wasn't totally sure at first. And then when she came back for the following session, she said, I haven't even thought about my family of origin since that session. She said, I don't think we need to do EMDR. She said, I feel better about it. She said, even when she looked in the mirror, she thought different words about herself and that it just started fading. So we switched from that point on into hypnosis.
Wow. And she must have been a hypnotic subject, it sounds like, if she was having that kind of emotional synthesis happening so early on.
And I figured she'd be good with hypnosis because she's very image and metaphor based. Like she's always talking about like her inner workings and how it's like a machine and how things play together. And like she was just always very, very imaginative and used those anyways. So I kind of wanted to go the hypnotherapy approach anyways, but clients or sometimes want a very specific treatment. And then I think once I sort of showed her the pages and pages and pages of history taking, after the first hypnotherapy session, she was basically hooked, and we've done that since.
Wow.
Yeah.
Well, I'm wondering if in terms of the group, does this sound familiar to any of you in terms of, are you also finding yourselves doing that kind of sometimes on the spot judgment of when to pause EMDR or when to move into more emphasis on hypnotherapy? I'm just kind of interested, wanted to get a read on the people online. How are you guys finding this so far? And do you have any questions for Heidi? Because Heidi does a lot of this, a lot of EMDR and a lot of hypnosis. So go ahead and type them in. I'll keep asking Heidi questions because I find this really interesting, like fascinating. Because I see in the little bits and pieces that I read about EMDR and in terms of what I hear from my students, sometimes from clients, what I like about it is it seems Ericksonian in that there is a trust of the person's internal resources. And I think I've even heard Francine Shapiro or a lot of EMDR therapists saying that, we don't really know what's happening, that like there's still a lot of research being done and what's going on from a brain-based perspective in terms of that bilateral stimulation. But so often you get those miracle moments in EMDR, just like you get them in hypnosis, where you're, as a therapist, simply holding the space. You're not directing the client. You're not telling them, here's the cognitive reframe. You're not feeding it to them, but that insight develops, right? So that's why I find, I think the two can work really nicely together, just because both EMDR and clinical hypnosis interventions, at least from an Ericksonian perspective, trust the creative unconscious as opposed to trusting 100% the skill of the therapist to direct the client somewhere, right? It's just those insights develop. Do you agree?
Yes. And even just on like the most basic levels of using hypnotherapy and EMDR. So even just doing your pacing, sort of your repetition, your flow of speech. So when I do the body scan, I probably naturally just use more sort of a hypnotic pacing for guiding the person through the body scan. Like I said, building that sort of the connection. The other place where I'll use a little bit of hypnotherapy is people who are in the advanced level of EMDR. You do cognitive interweaving. So if the person seems stuck on a certain memory or they can't quite get themselves to a place of doing that, reinstilling like that VOC EMDR language, you start to do cognitive interweaving. So what I've found, VOC is validity of the cognition. So you're trying to replace their old belief about themselves with their new positive belief of themselves. And some people get stuck on that part. So then what's recommended by Francine Shapiro is to do a little bit of that cognitive interweaving. So I found the best way to do the cognitive interweaving is using a little bit of a yes set. So after they describe the memory to me, I'll say, so take a childhood abuse case. So you were very young. Yes. You shouldn't have been in control of that situation. No. It should have been an adult's responsibility to take care of you. Yes. And then the part where they're trying to instill, I say, so was it that little girl's fault? No. So by using a little bit of that sort of yes set framework of the cognitive interweaving, I find that it just sort of enhances that process a bit for them.
Yeah, right. It's like you're kind of pacing and leading.
A bit, yeah. So, I mean, that's when you get into that more advanced sort of the cognitive interweaving. But I find if you sort of frame it from that yes, 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 and then ask them that cognitive piece, then it's a little bit of a priming, but it's all their own stuff, right? So I'm only taking what they've described to me, what they've shown to me, but then I just help with that little piece where they're stuck of getting that new belief put in.
Okay, because I've also heard, I was talking with Carolyn Deitch one time about the EMDR and the hypnosis, and she talked about using it at the end of the EMDR with resource installation. And she talked about how she would bring in hypnosis to do the future kind of like a progression, like progression work in hypnosis to help with that.
Mm-hmm. So I've used that technique as well. So I'll do sort of the traditional resource installation through the EMDR, doing the eye movements. After we're finished that process, I'll often have the client just close their eyes, sort of get them into a light trance, and then I'll ask them to either play out what that would look like as a movie. So if it's they're trying to accomplish new skills at work, or they're trying to, see things differently at home, like play out that movie, and I'll ask the questions, what would you be wearing? How would you be holding your body? What would you be saying? So just doing a little bit, very similar to the EMDR, but I just play it out a bit longer for them and have them play sort of this movie out in their mind, right? And then, of course, the homework piece of that is a little bit hypnosis, a little bit EMDR. I'll say, okay, use that anchoring. So when you get up in the morning, set your intention that you are that person. How would you look in the mirror? What would you say to yourself? So I'm using a little bit of that self-hypnosis to help with the EMDR homework as well.
Oh, I like that. Yeah, great. So Heidi, do you do like how much of the week during the week, because I know you have a lot of clients per week, how much of the time are you bringing hypnosis in, rough ballpark figure, and how much of the time are you bringing EMDR in? Because I know everyone here is wanting to know that answer.
Right. So I would say hypnosis, if it's formal hypnosis, so they book like a hypnosis session and they're asking for hypnosis, is probably, I'd say, 40 to 50% of my day. Usually half my clients are looking for some form of hypnosis, whether I've introduced it to them or they've requested it specifically. I'd say 20 to 30% is EMDR. I mostly use it for trauma. I know it's expanded to a lot of other areas and topics, and that I mostly use it for PTSD and for trauma-related incidences. Hypnotherapy informally, I would say it's probably, 90% of what I bring in. So I work with a lot of kids and teens. So using hypnosis in the sense of, eyes open, not doing the formal sort of induction or trance, but having them describe things as images and metaphors. And so an example, like kids who have been bullied, I'll use the imagery of a sponge versus a mirror. And I'll say, you have a choice in life where you can be a sponge, where you take on what people say to you, and you take on other people's words, and you take on what's surrounding you in negativity. And I'll ask them, so what happens to a sponge? And they can usually tell you a great story, like it gets moldy or it gets dirty and it's gross and you want to throw it away. And I'm like, right. So I'm like, or we have a choice to be a mirror. And what do mirrors look like? Oh, they're strong and they have a nice frame and they're beautiful, right? And so I'll use like that imagery. So you're doing it sort of hypnotic language, you're talking to them about it, but essentially you're trying to instill, so you have a choice. Do you want to take on what people are giving you, or do you want to reflect it back out? And that's just a reflection of what's going on with that person or what's going on in their life. And it's not yours to take home with you, because we don't want to be a sponge. And then I can use that sort of anchoring for the reinforcement, right? And, they'll come in and they'll be like, oh, I was a mirror all week. And they're all excited about it. And so it's not formal hypnosis in the sense of doing the induction and having them close their eyes and the relaxation and the deepening, but absolutely in that sort of Ericksonian sense of metaphors and imagery and creating a story for them.
Yeah. I think I heard Ernest Rossi say once, or maybe it was a reference to a Milton Erickson quote, just keying into exactly what you're saying, that the difference between, a skilled clinician and a clinician who brings psychotherapy as an art and science to people is that the artful therapist is hypnotic, whether they're trained in hypnosis or not. So it's that element of bringing in that hypnotic resonance, right?
Mm-hmm.
It's so spectacular. So yeah, you're seeing yourself 90% of the time.
Yeah, I'm incorporating some form of it, whether it's being images, metaphor, whether it's progressive relaxation, just, tipped up a little bit. A lot of it. Like I said, even when I do EMDR, I feel like I am a clinical hypnotherapist and I do EMDR. So I feel like my EMDR comes across a little bit more hypnothetic. It's kind of hard for me to now separate the two.
Yes, it becomes impossible. I don't know if you guys are finding that. It does become impossible not to be hypnotic in sessions, because it becomes just the way you roll. So if you're using EMDR for mostly trauma and PTSD, do you have any trauma clients wherein you're just doing, say, hypnosis work?
Mm-hmm. So this is where I really factor in client buy-in, one way or the other. So after I do sort of the first session with clients, the history taking, figure out why they're sort of there, what they're hoping to achieve. If they're sort of on the fence, if they don't know a lot about therapy or counseling, I'll often write down clinical hypnotherapy and I'll write down EMDR, Francine Shapiro. And I'll ask them, just do a little bit of research, see what you can find. I have a meditation website. I'll be like, check out these meditations online, see what you think of them. And usually when they come back to the second session, some of them sort of have clear insight as to which direction they want to go. So usually if I introduce EMDR and I get the eye roll and that sounds completely out there, I'm not interested in that, or vice versa with hypnosis. Oh, that's never going to work for me. I let the client kind of guide that then, right? So, I've had, some clients come in and they just did not buy into the EMDR at all. They're like, how is waving your fingers in my face going to make me feel better? And they chose hypnosis. Vice versa, other people said hypnosis doesn't work, or they have certain negative beliefs about it, and I go EMDR. So I definitely use both interchangeably, but there is times, and it's usually client driven, where I strictly stick with one or the other.
Okay. That's great, Heidi. Well, let me open it up to the group a little bit. Do you guys have any challenges, or do you have any clinical quandaries in terms of either EMDR or just in general, any of the trance work you've been doing? Heidi and I would love to hear from you. So you can type in a question for Heidi or for me, or you can use the Ask a Question section. Heidi, we have the same cup, I think.
Oh, we are matching.
Yeah. Yeah. We didn't plan that ahead of time. Okay, so it doesn't look like there are any questions. Yeah. Well, have you had any challenges lately, Heidi? With either EMDR or hypnosis or both, or?
And I really find that having training in both has absolutely helped with the challenges, right? So being able to pause EMDR and go a different direction. People who don't feel like hypnosis is intense enough or enough therapeutic work, then I go into that EMDR. So it's really nice sort of having a toolkit to work with. I find clients like it too. Some clients will come in apprehensive about the EMDR just because they had a really bad week or they didn't sleep the night before and I'm just not sure I'm ready for it. So I'll either do even just a little bit of mini hypnosis. So we'll do 15 minutes of like relaxation, just a little bit of trance work. And then I'll ask them afterwards, do you feel ready to get into the EMDR? Sometimes it's yes, sometimes it's no. And we'll just, do a little bit of CBT and talking and homework and intention setting. So even if it's just, a 15-minute pause for them, right? And then, like I said, too, just using it in those very basic moments of EMDR, just the way you present, the safe place, the way that you do the body scan. So talking about, starting at the top of your head and working downwards. And I just find using that flow of speech and more of the hypnotic rhythm made it less protocol-y for me. The one thing I found with EMDR is it's very protocol driven, it's very formal, and sometimes I had a little bit of trouble adapting to that. So I found by just putting in my flow of speech, my tone, my pace, made it feel a little bit more mine versus just kind of reading down through the protocol and going step by step by step by step.
Okay. Wow. Awesome. So, okay, you're making it sound really easy. And I know in terms of people who are going to be watching this or are listening now, they may have just recently, as in June, I know a couple people just in June have taken the training. And they're going to be thinking, Heidi must have been doing both of these things. And she must have been doing clinical hypnosis for 20 years. So tell us a little bit, especially for the new graduates. Are you still using the same script every time for hypnotic induction?
No.
Okay. And B, how long did it take for you? And what did you do? Because you speak like with real, finesse in terms of being able to think on the spot, being able to bring in a technique here, an ego strengthening there. So tell us a little bit about how you got to where you are now. How long did it take? What helped you the most?
That's an easy question.
Okay.
So, like I said, I was trained in EMDR first. I took that in 2014. Like I said, I struggled with the very protocol approach to it. So, trying to use the same phrasing. Okay, just go with that. Okay, just go with that. Okay, just go with that. And it was hard to test it out because I just felt like I was reading something off of a piece of paper. But once I started to play with it, and really sold me on EMDR was the effectiveness. So when I would have clients say to me, I can't hear the sound anymore of the accident. I can't feel the glass shattering, those types of things. Like that just became so powerful that I knew it was something that I wanted to stick with. It just didn't totally feel like me. So then I took Karen's first training, looking on my wall here, November of 2015. Did the very first foundations of hypnosis. So it wasn't that long ago. And it really spoke to me. I started practicing it right away, using it in different levels. Like I said, in the beginning, you can introduce it to your clients, find what word they like. So I'll say, how do you feel about progressive relaxation? How do you feel about meditation? How do you feel about guided imagery? And then would you like to do some hypnosis? Right? So you can use different words to see their level of comfort with it is how I first started, right? I mean, now I'll just say, what do you think of hypnosis? But I definitely introduced it slowly so that I can introduce it slowly, get my own practice with it, right? I would just do it from sort of that safe place with people with anxiety, like taking you to a place where you didn't have to worry or you didn't have to focus so much on what was going on, those types of things. And then, like I said, once I started integrating the two, seeing how far I could go, seeing especially with hypnosis, how quickly people were getting results. Saying that they'd been in talk therapy for 10 plus years, that they just couldn't quite let go of a certain memory or a certain belief or a certain feeling. And then with 2 or 3 hypnosis sessions, they were thinking totally differently, or they had let it go, or it just didn't feel like it was part of them anymore. When you start to see that response and that level of effectiveness with your clients, then that really starts to increase your own confidence. And then you want to try it more, and you want to do it more, and you want to incorporate it more. And then eventually, I guess for me, after 3 years, it just becomes almost what I do.
Okay. And what I know, because we were talking about this before the call, like I know you're doing a lot of bringing hypnotherapy in for a lot of clients. Okay, so I know that what students are struggling with sometimes is that they don't feel confident. So what I hear a lot is I'm waiting to feel a little more confident with more family, more friends before I bring it to clients. And so can you speak to that a bit, just in terms of, while you answer, I'm going to look, I just see I have a question, but
Sure.
that confidence thing, sometimes it becomes a barrier because people don't feel confident enough. They're afraid they're going to do something wrong in hypnosis.
Mm-hmm.
So how did you deal with that for yourself?
So I think one of the best things that built my confidence, and I think it may have been you that said it to me, is one of the skills in hypnotherapy is Erickson's confusion approach. So if you stumble over your words, or you say something wrong, or you go off tangent, essentially that's deepening the client, right? And I think once I let go of that fear, and sometimes I kind of forget my place, or my mind's wandered a little bit, but the client's still in trance, and I figure that's just a deepening experience for them. If I used the wrong word, or it went a little bit away, a different way I didn't think it was going to go, as well as trusting your client too. So I feel even when I bring them to a certain place, or I use certain imagery, the client will bring in what they want to do. So I have this sort of beach one that I use for letting go, where they're either writing something in the sand, or they're washing something out to sea, sort of a forgiveness thing. And I use this imagery of they're writing it with a seashell. And I had one client who saw a big purple sea slug come out of the ocean, and it was a representation of this person who was in her life, and she didn't want him anymore. And, she put it back out to sea. Like, none of that was anything that I said at all. So yeah. I feel like their unconscious is going to do the work that it wants to do anyways. It wasn't even said that what she wanted to work on. And I think once you start to see that, and you can play with that and have lightness to it, you start to build your confidence, right? Yeah. Again, like I said, introducing it as just part of the session, right? So it doesn't have to be a full hypnotherapy session. If you feel like you've sort of done your CBT work or your solution focus work, how about we finish our session with trying some way to release anxiety, right? Yeah. So induce like a little 20-minute piece of it. Get your confidence going that way. And if the client really likes that, well, then that's your right client to start to build doing longer sessions with.
Yeah, nice. Okay. I'm just reading a question that says from Karen, I'm so happy that you asked that question, I guess, about the confidence. I trained in EMDR 3 years, over the past 3 years. And I also struggle with the rigidity of the protocol. Okay. It has been a challenge for me to actively use it for that reason, although I regularly use it for resource development. I just trained with Karen, and I'm finding it intimidating to do the hypnosis as well. Yes, it can be intimidating. I know. I find myself getting worried about what to say and how to use it consistently. So I know what Karen means here. It's that worry about, will I say, especially when we're new, right? Will I say the right thing? Wording, and probably I scare too many students, and I have to improve in this, Heidi, in that I talk about how important wording is and phraseology in hypnosis. So maybe I scare people into, you might say the wrong thing. But I don't know if this is helpful, Karen, but I say the wrong thing all the time by accident. And so then I just go back, or I sometimes will be in session and a person is in a deep trance and I'll find myself like this, like, I have no clue. So I'll just, okay. And as long, what I find for myself, and I'd love to hear your feedback, Heidi, is as long as I remain in my calm, parasympathetic, low, slow brainwave state, and candles, and I know the person asking the question, my aromatherapy helps. I know that aromatherapy helps her too. So this lower, slower brainwave state, when I'm in it, I also have faith just from practicing, which I know new students don't have, but I absolutely trust the person's creative unconscious. I also have spiritual beliefs. And so sometimes I will ask quietly for guidance. I know this is going to sound insane for some people, but I have in my head WWMD, like what would Milton do? And so, I have my little mental techniques that I do. Like, I have no clue what to say right here. So I'll just wait until something. And so much of hypnosis for me is that holding the space. And sometimes I'll just go like this with my hands. I know this is all sounding very insane, but if I just go like this, it just helps me to co-regulate with the client. And then I just trust that what needs to flow will flow. Like, I've got 2 or 3 notes of where I want to go eventually in the session, but just to be in that energetic state of kind of, to use brain speak, co-regulation with the client. But it is that just my unconscious is working with your unconscious. That helps me get over my fear of not saying the right thing. Yeah, but what about you, Heidi? Would it add some more?
Yeah, so I think it was similar than any other approach, remembering being a practicum student when you first graduate, even, CBT seems overwhelming, solution focus seems overwhelming. What if you ask a miracle question and they have no answer? Right. So I think, throughout your practice and throughout your evolution, there's always times of, trepidation and fear. But you just keep moving forward as you would. And like you said, having that internal confidence, having the nice brain waves. A lot of times when you start doing hypnosis, being aware of your client's body language. So if they're still like this, well, then I know I need to do a little more deepening and relaxation. If they start to seem very emotional, you can usually tell if it's a bad emotion or a good emotion, and maybe holding them there for a little bit. I always ask after every hypnotherapy session what they liked about it, what they didn't. Clients are very open with telling you that. They're like, you know what, I saw this beautiful color and I love the color. But as soon as you said the word relax, I got all tense, because that's what my ex-partner used to say to me. So I'll make a note in their file, does not like the word relax. Yeah. So it's working sort of back and forth with your client. Another thing that built my confidence, to be honest, is reading Milton Erickson's case studies and the absolute bizarre and crazy things that he would do. And they were successful. So I'm like, if he can do these things and be completely successful, I can run a hypnotherapy session.
Oh, that is so good. Yes, some of those case studies seem beyond insane. It's like, yes, you had to be there, but indeed, I think so much of his brilliance was in that hypnotic interspace, that interpsychic space. That, yeah, words are important, but it's also just as important that your unconscious is working with the other person's brilliant unconscious.
Absolutely.
Kathy's asking a question. She's saying, firstly, thanks, Heidi, for the refresher and how effective hypnotherapy is and your confidence in it. I wanted to share that I have a child that has anxiety, and we were working in a school, and students had a computer class out in the hallway. I thought because of the noise, she would not have gotten into trance. After she shared, she hadn't even noticed the noise until we were finished. Oh, thank you for sharing that.
So I've had that come up a lot, like in our last training. As Karen can speak to, we happened to be with a loud trance meditative group who had drumming and everything else going on while we were trying to learn hypnosis. And one of the things is learning to use noise as a deepener. So you can actually include that right into your hypnotic work. So letting all the sounds deepen your relaxation. My office is on a busy street with a highway near it, so I get traffic noise. So I'll say, in the beginning, as each car passes, so using that level of initial awareness to start to deepen it. So with each car that goes by, you breathe a little deeper. Each car that passes, you let go a little more. And then you just they'll eventually turn that new noise out. And then I have had a lot of clients say that that's sort of how they know they're in trance, is that the noise is suddenly gone. And then as I start to do the count back to bring them back into the room, they can start to hear everything. They can start to hear the voices. They can start to hear the beeping of machines, the traffic. So yeah, that's another thing. I feel like a lot of people get stuck on it having to be perfectly quiet, that it's not going to work if there's distractions. But again, either using it as a resource to deepen them, or sort of just teaching them to have that mind drift away with the noise. So as the noise drifts away, so does the conscious mind. So you can put it right into it. And clients will naturally start to tune it out as well.
Yes. Yeah. Do you have any favorite hypnotic bridgeway phrases? Like you just used one right there as I can't remember what you just said now because I was half in trance when you were talking, but as the traffic fades away, your consciousness fades away or something like that. Do you have any sort of those segue trancey phrases?
Oh, probably. I try to incorporate as much as what's around me into it. Unfortunately, it seems like, Murphy's Law, every time I do a hypnotic trance based on trauma that involved an accident or accident scenes, an ambulance seems to go by. Oh. And so I'll bring that in. I'll be like, just like you can hear the noise and you're allowing your eyes to stay closed, a little bit of the truisms, you're still breathing, you're still here in the chair, you can feel the chair. And as the sirens drift away, you let go of it. Murphy's Law, things are going to come up in your session that you don't want to have come up, but just go with it and bring it into the session. Comment, like if their eyes open up, they'll be like, oh, your eyes opened up. You felt that, just like that. And I said, now you go back to that relaxed state. Use a little bit of pendulation, right? Another sort of technique that you can bring into it. Specific statements for confidence building. To be honest, in the beginning, I did use and research a ton of scripts. I bought all kinds of hypnotic books for every topic you could possibly think of. I had Hammond's book, the big red book of images and metaphors. And before a client session, I would make notes. I would reference certain images. I'd find these key lines that I really did like, that I thought the person would connect to. So I did have notes in front of me on a little clipboard, and in case I lost my train of thought or needed a reference point. And the clients never said anything about that, right? So they've never questioned that I needed something in front of me. I say that there's some well-researched metaphors and images that work very well with specific topics. So I have a few notes on those images and metaphors, and then they don't question it. Right. So if it's something where clients have very specific language, so like I said, the woman who had the 3 words that bothered her the most, I do write those down. I do put them in front of me. I do put the notes that she of the words that she wants to replace with them. And then I'll do an induction, do a deepener, and then I have my reference in front of me, because once you do that sort of hypnotic work, your mind isn't always connected to it. So I do need a reminder sometimes of what her exact wording was, right? Like I said, in the files, I always write if there's a word that they don't like. Right. So like the word relax, it brought her out of trance every time. So I make a note of that so that I know not to use that word, and I'll have that sitting in front of me. No, relax. So building your confidence that way.
Great. We have another question from Anita. I'm just going to read it here. Recently, Anita was certified and had lots of exposure to Ericksonian and NLP approaches over the years. I also integrated informally, I suppose the NLP too, throughout most of my work. Now I have a new client who is asking me to teach him self-hypnosis. Intellectual, somewhat cynical gentleman struggling with sleep and anxiety. My confidence is a little shaky about this because suddenly he regards me as the expert. Any tips? I remain fully aware of the idea that all hypnosis is self-hypnosis. That's a famous Erickson quote. I think it's a famous Erickson quote. Mm-hmm. All hypnosis is self-hypnosis. So Anita understands this. She's got lots of experience with Ericksonian and NLP, recently certified in clinical counseling hypnotherapy. And she's using it, but then this intellectual client is saying, and he's somewhat cynical, doesn't make it easier, is saying, hey, can you teach me self-hypnosis for sleep and anxiety? Okay, Heidi, what would you do?
Sometimes cynical people, there is a YouTube channel called The Honest Guys, and it has hundreds of hours of pre-recorded guided meditations. And if you subscribe to their little page, and it's all free, you can search ones that say binaural beats. So if you research binaural beats, essentially it uses certain tones and certain frequencies of music in different ears at the same time. And I describe that as it confuses your brainwaves. So when your brainwaves get confused, they sort of go into more of a hypnotic trance. So for my clients that aren't too sure about it, I'll say go home. The website is on YouTube, and it's called The Honest Guys. So you can search them on YouTube.
The Honest.
Yeah, The Honest Guys. And binaural beats is the one that I'll guide them to, and I'll say put that on at nighttime. And depending on what your client buys into or doesn't buy into, I'll either say while you're listening to binaural beat music, if they're very sort of imaginative, I'll say, what is an image or a place that you like to go to? So while you're listening to the music, imagine you're at the lake, or you're out camping, or you're sitting by the fire. If they're more logical, mathematical, cognitive based, I'll have them do some breathing exercises. So like the 4-7-8 breath work, or the 4 squared breathing, or I'll do a counting one. So do 99 minus 2, imagine writing it on the blackboard, 97 minus 2, 95, writing on the blackboard. So essentially trying to just induce that state of relaxation using what resources your client already has, right? So if they're analytical, I use numbers. If they're imagery, they like images, I'll use that. Sometimes I'll use color. So imagine being awake is bright yellow. How could you darken yellow, which is sleep? So maybe what is sleep? Sleep is navy blue. Okay, well, how do we darken yellow to navy blue? And doing that while listening to the meditative music, right? So I find if you put in, like for the clients, a little bit of science, so talking about the binaural beats, talking about brain waves and how to lower them, and the thetas before the sleep waves, you get a bit of buy-in that way.
Yeah, good. Excellent. Well, thank you, Heidi, and good luck, Anita. Well, let us know how it goes with Mr. Cynical. And yeah, he sees you as the expert, so you clearly are. It's all right. You're clearly the expert because it's the observer always holds the truth, right? Not the subject. So at least in case of clinical hypnosis.
And you just flow with that, and you keep practicing that.
You're the expert. That's true. Yeah. And he's okay. She likes those metaphors. Yeah, that's a great resource. I didn't know about that, Heidi. So people are saying this has been helpful. So we might have you as a reoccurring guest, Ms. Heidi. So,
I'd be happy to come back.
And let everyone know that Heidi is running a training in Los Cabos. It's going to be splendid. She's doing the clinical counseling hypnotherapist certification. So I think most people on already have that certification, but if you know of colleagues who want to go to the beach with Heidi in March, right? Is it March?
It's in March, yeah, on Karen's website.
It's on the Daybreak website. Yes, it is. Okay. Excellent. So thank you so much, Heidi. I really appreciate it. And I know this has been great for people. Feel free to continue to send us or email me anything you want to have discussed at our November clinical huddle. If you ever have a case study or a clinical scenario or just a specialty topic like EMDR tonight, just email it over I'll send you guys the recording and we'll take it from there. So thanks, everybody. Thanks, Heidi.
Thanks, everyone.
Bye.
Bye.
Okay, we're going to end.